cranial nerve 1 is the olfactory nerve, and a way that we remember this is using one finger to pick your nose. And to test this, you're going to have the patient smell something strong or familiar like coffee grounds. So you'll just have your patient sniff it with their eyes closed and try to identify the scent.
Alright, so for cranial nerve 2, which is going to be the optic nerve, a good way to remember it is that we have two eyes. So cranial number 2, we have two eyes. And the way to test for this is to have your patient read something off a clock or a clock across the room, or you can have them read something off of paper. So if they can read it, that kind of shows that cranial nerve 2 is intact.
So cranial nerve 3 is ocular motor. Ocular motor you can think of as 3 pillars holding up the eyelids. It also looks at eye movements, so left to right, up and down, and diagonal, along with pupil size and reactivity. So ways to test for this is have the patient sit in front of you and shine a light into their eye. Their pupils should constrict. You can also have them follow your finger left, right, up, down, and diagonal. You can also look for convergence. This, you'll stand in front of the patient, have them follow your eye in and out. Their eyes should go down and converge into each other.
Next cranial nerve we're going to talk about is cranial nerve 4. This is the trochlear nerve. This is responsible for bringing your eyes crossward. So you're going to have the patient bring your eyes looking down and in.
Cranial nerve 5 is the trigeminal nerve. So this is one of the largest cranial nerves as it has 3 different branches that innervate the face. So a way to remember this is holding up the 3 different branches and where they innervate like so. And it tests chewing and sensation of the face. So you can test this by having your patient chew something, and you would have the therapist test the patient for sensation by having them close their eyes and lightly swabbing their face with a cotton ball and having them identify where on the face that you had touched.
Alright, so for cranial nerve 6 is the abducens nerve. For this nerve, it's testing the function of your eye's ability to move laterally. So a good way to remember this is abducens, abduct. So your eyes are abducting to the side. And a way to test this is to test for your patient, hold a finger in front of their face and have them follow your finger side to side. And if you see the eyes moving laterally, that shows that they have function of their 6th cranial nerve.
So this one is cranial nerve 7. It's the facial nerve. You can think about this one as it encompasses everything that the face does. So facial expressions, corneal reflexes, eyelid and lip closure, and it also talks about taste. So to test for this one, you can have your patient do all the different face movements. So smiling, raising your eyelids eyebrows up and down. You can also put a piece of sugar or salt on their tongue to see if they can taste it.
The next nerve is cranial nerve 8. This is our vestibular cochlear nerve. This is testing for your hearing and equilibrium, which is balance. So to test for your hearing, you would have a tuning fork, or you can rub your fingers near a patient's ear. You can also whisper in their ear to test for their hearing. For equilibrium, you would refer this to a specialist.
Cranial nerve 9 is the Glossopharyngeal nerve, and the way you can remember this is that it starts with a G and it looks at gagging and swallowing reflexes. It's a sensory nerve, and you can test this by having your sticking a tongue depressor in your patient's mouth and seeing if their gag reflex is present. And then to test for swallowing, you can just have your patient swallow and see if their throat is moving appropriately.
Cranial nerve 10 is the vagus nerve. The vagus nerve tests for gagging and swallowing. A great way to remember this is a night out in Vegas, a little bit too much to drink, and an upset tummy. This can sometimes lead to gagging. A great way to test for this is the same way to test for cranial nerve 9. So you'd use a tongue depressor on your patient's tongue and see if their gag reflex is present. To test for swallowing, you would look at their swallowing and see if the swallowing is tested appropriately.
Cranial nerve 11 is the spinal accessory nerve. You can think of this one as 11, 2 ones moving the shoulders up and down. So this one that looks at shoulder movement and head rotation. So you can go ahead and have your patient move their shoulders up and down and then their head to the right and left.
Cranial nerve 12 is the hypoglossal nerve. This is responsible for tongue movement and speech articulation. So to test this, you would have the patient stick their tongue out, and you would also have them moving their tongue from cheek to cheek in the inside.